Welcome. My name is Tracy Meyer. I'm the Chief Medical Officer at Psychiatric Institute of Washington. I'm here to present our poster on Safety Awareness Month. For those of you who don't know, PIW was founded over 50 years ago. We have 130 beds to serve acute psychiatric patients in crisis. We take involuntary and involuntary patients as well as adults and adolescent patients. At any given time, we serve about 40 to 50% of any acute crises happening in DC. And throughout COVID, we did experience staff turnover and staff shortages. We really wanted to refocus on some fundamentals at PIW, including safety measures. So we had our leadership team decided that we really wanted to hone in on safety checks and the quality of safety checks, as well as compliance with safety checks. And as we met, we realized that we really wanted to bring a huge emphasis on lots of safety measures that we try to implement at PIW. So we developed a committee to determine the objectives for Safety Awareness Month. The first was to improve measures of safety. The second was to re-educate staff on all policies and procedures related to safety. And the third was to recognize staff who demonstrated extraordinary work ethic and commitment to safety. For our methods, there were 5 parts. The first was to form a committee, which comprised of myself, the CNO, Director of Clinical Services, Director of Quality, as well as the risk manager. We met twice weekly in the month of December in order to launch Safety Awareness Month in January 2022. Our first task was to come up with a calendar of events. Each day was going to have a pertinent safety topic. And we kicked off the month with distribution of safety pledges that the staff signed, as well as a Safety Month t-shirt. On the back of the t-shirt, it said "Checks Saves Lives," which was the overarching theme throughout the month. The third part of our method was to develop all the education materials. Each topic of the day had specific tip sheets, interactive activities, handouts, highlighting all the permanent and related hospital policies related to safety on that topic. We had an education booth that was staffed twice a day in order to catch 2 shift changes. And then the next step was to establish some data collection methods, QR codes, and nominations for awards. We had QR codes in order for staff to submit good catches, and this is when a staff is able to intervene to prevent a possible negative outcome, and also to provide the clinical leadership feedback at the end of the month. Staff were also encouraged throughout the month to nominate peers, especially for a safety champion title. These were people who demonstrated and above and beyond work ethic, as well as commitment to safety at PIW. And finally, in order to do some data collection, we reviewed cameras in order to monitor for safety check compliance, and then collected incident reporting to monitor levels and incidences of patient aggression. And then finally, staff recognition was the culmination of our safety month. We recognized people in 5 different ways. We provided raffle tickets for everybody who participated in all the events throughout the month, and there was raffle prizes, including an Apple Watch. We also had activities for a safety poem and a safety poster. Each of those had individual winners. We also had an award for Good Catch of the Month. All the staff also received a food truck ticket when they completed the feedback survey at the end of the month. And finally, our biggest award was nominating 10 safety champions. And those people were recognized by their treatment team, as well as clinical leadership, with a trophy, a gift card, and a celebration in the hospital. So the results of our efforts were quite positive. We were very excited to see improvement within 2 to 3 months. Safety checks increased by 55%, patient aggression decreased by 119%, patient incidences decreased by 43.9%, good catch reporting increased by 200%, and 90% of staff felt Safety Month was, quote, extremely helpful in their response in the feedback survey. In conclusion, we felt like Safety Month was extremely well received by staff. It was it had definitely measurable positive outcomes. We as a team at PIW continue to make this a huge focus of our care at PIW. We are now involving our safety champions also to come up with innovative and measurable ways to improve quality and safety at PIW. And we hope to make this an annual event. Thank you.